My name is Jill Morgan, and I'm a professor and chair at the University of Maryland School of Pharmacy in Baltimore, Maryland. Welcome to the second episode of the FIP CPD Bites series on pediatric pain management. Building on the insights from our first CPD Bite, where we covered recognizing and assessing pain and fever in children, today we're going to explore how to manage pain and fever across different age groups. By the end of this video, you'll be able to compare pain and fever management strategies across pediatric age groups, identify the most appropriate non-prescription medicines for managing pain and fever in children, discuss considerations for selecting different medicine dosage forms based on age and specific needs, and educate caregivers on the safe and effective use of these medicines. To get started, it's important to understand that all babies and all children can feel pain. So if a baby or a child is upset or crying, the parent needs to try to figure out the cause for their pain. And then, once they do that, they need to determine if it can be safely treated at home. Now, keep in mind that pain in children is a very large and a very complex topic, and we're just going to touch briefly on some of those areas today. Some common conditions that can be treated at home include mild headaches, muscle aches, sprains, and muscle cramps. Recurrent headaches and belly aches are two conditions that require further evaluation. If a baby's under 3 months of age and they're inconsolable, as we discussed in the first episode, they should be referred for further medical care to address any underlying issues. Now, fevers cause significant concern in parents, but not all fevers require treatment with medications. Parents worry about fevers. They worry about the bad effects that fevers can cause. But fevers are our body's way of fighting infection. They stimulate the immune response and make it harder for germs to replicate. Parents need to understand that a fever from an infection is very different from heat stroke. Heat stroke is dangerous for a child and needs to be addressed by a medical provider. But fevers are protective to our bodies. Not all fevers should be treated. Only when a child is uncomfortable should a child receive treatment for a fever. Now, the two most common over-the-counter medications for pain and fever are acetaminophen or paracetamol and ibuprofen. Both have analgesic and antipyretic action, with ibuprofen having anti-inflammatory action. Ibuprofen and paracetamol have comparable efficacy in the treatment of acute pain and fever in children and similar tolerability profiles when used at recommended doses over short periods of time. Acetaminophen is dosed at 10 to 15 milligrams per kilogram per dose every 4 to 6 hours. For maximum effect, it's recommended to use the upper dosing limit and a calculated dose based on the child's weight. Make sure that that dose is measurable. Acetaminophen can be given to children with or without food. Ibuprofen is recommended for patients over 3 months of age. The dose is 10 milligrams per kilo per dose, given every 6 hours if needed, and again should be calculated based on the child's weight. For over-the-counter use, the maximum recommended dose is 1,200 milligrams per day. And for adolescents, the maximum dose is generally about 800 milligrams per dose if there is a prescription. Ibuprofen doses given at the over-the-counter doses and when used for less than a week can be given with or without food. When recommending either one of these medications, please be sure to always calculate an exact dose and explain to parents and caregivers how many mLs or tablets a child should receive for the dose. Now, occasionally the question comes up, should we use both medications and should we alternate acetaminophen and ibuprofen? What we know from the literature is that alternating doses of acetaminophen and ibuprofen are found to be statistically significant in lowering the temperature. However, there's no difference in improving the child's comfort. Therefore, in general, you should avoid this recommendation because there is a high risk of medication errors when it comes to alternating doses. Now, if you have a provider that recommends this, then what you want to do as a pharmacist is to recommend one medication now and the other medication to be given 3 hours later. Advise the parents to keep a log and a record the time and the medication that's administered, and also make sure that the parents understand how to dose each medication for their child. The question will often come up about which dosage form to use. And it's important to understand that there's a variety of dosage forms for over-the-counter acetaminophen and ibuprofen. And this chart has a sampling of some of the most common ones and common concentrations. Please keep in mind that this might not include everything that's out there across all the different countries. Acetaminophen is available as a suspension, a chewable tablet, dissolvable packets, rectal suppositories, tablets, and capsules. Ibuprofen comes as a suspension, chewable tablets, and tablets. Also for ibuprofen, the active ingredient strength is listed here in the chart, okay? Now, when it comes to picking one for your patients, choose the form based on the child's age and their ability to take that medication. In general, children learn how to swallow tablets somewhere around the age of 5 to 7. So before that age, a different dosage form is preferred. And you can always ask, does your child swallow tablets? And then you know that that's an acceptable dosage form to recommend. Infant suspensions are preferred for children under age 3 and often come with a dosing syringe. Suspensions and chewable tablets are recommended for patients 2 years and above. If a child's eating a regular diet, then that generally tells you that they're able to handle a chewable tablet. And keep in mind that when you dose those tablets, they should be dosed as either a full tablet or a half a tablet, not smaller parts of the tablet. The dissolvable packets that are available that pour directly on your tongue are recommended not to be divided, and they're for children over 6 years of age. Rectal suppositories should be reserved for kids who can't take any oral medication. For example, kids that are having vomiting. These suppository dosage should also not be divided up because it can be difficult for parents to estimate a correct dose if you recommend to give half or a quarter or an eighth of a suppository. Also keep in mind that acetaminophen and ibuprofen, these medications are bitter, so flavorings are very important to help make them more palatable. The liquids are available in a variety of flavors, mostly fruit flavors like grape, berry, and bubblegum to help with acceptability. If a child doesn't like the taste or the texture, then try a different dosage form or a different flavor. If this doesn't work, then you can try and have the parents numb their taste buds with an ice cube or a popsicle. You could also have the parents give the dose of medicine and then follow it with a little bit of chocolate syrup because that will help to mask some of the bitterness. In addition to thinking about the child's preference, it's also important to refer to local guidelines depending on the country, as recommendations and availability of certain formulations may vary. When we think about contraindications for acetaminophen, the main concern is to be careful using this medication in any patient with hepatic dysfunction, since this medication can cause liver issues when it is used too often or at toxic doses. For ibuprofen, it should be avoided in patients that have an aspirin or an NSAID allergy because there can be some cross-reactivity. You also have to be careful about avoiding ibuprofen in anybody that is currently bleeding or if there's uncontrolled heart failure, since this medication can worsen these conditions. When talking to parents and caregivers, please be sure to first calculate an appropriate dose based on the child's recent weight. Write down the dose in milligrams and mLs if it's a liquid dose, or the number of tablets. Show them the exact preparation that you recommend. If the dose is a liquid, explain how to correctly measure the dose, since there's significant data that show that this is an area of concern. Explain when and how to administer the medication and what to do if the child does not get better or gets worse. You can check the parent's understanding by asking them to explain back to you what you just said to make sure that you didn't forget to tell them anything. In summary, all kids can feel pain and their pain needs to be treated, but all fevers do not need to be treated. Acetaminophen can be used at any age, while ibuprofen should be reserved for infants over 3 months of age. Recommend against alternating doses of these two medications. And be sure to choose the appropriate dosage form and calculate an accurate dose for the child. Explain all of this to the parents so that they understand when and how to best use these medications. In the next episode, we'll focus on practical strategies and case scenarios for supporting the care transitions as the child grows. Thank you.